Let's say, so if your patient has CHF, and Mia, tell me what CHF is again. What does congestive heart failure mean? What does that mean in simple terms?
Your heart sucks.
The heart sucks. So if the heart sucks, is it going to be pumping adequately or not?
It's not.
It's not. Okay, so then what's going to happen is that all the blood that should be coming in is not going to back up, right? So it'll start backing up. If this patient is able to walk around and function good enough, right? They don't need help walking around or anything. Gravity is gonna take over and it's going to pull that blood down to their feet, right? And so this patient that has CHF is going to physically present with what? What is this called? Pedal edema. If this patient is bedridden, where is it gonna show? It's gonna show where though? Keep it simple for me. On their back, right? Most people sleep on their back, so it's gonna show on their back. Or that, because it's about gravity. Gravity's taking over, so gravity takes over here. And what is this called again? If the blood or fluid is pulling on their back? It's called sacral edema. Cool. Okay.
I have a quick question.
What?
If someone has like a pedal edema, if they lay down for a while, will it turn into sacral edema?
Yes.
And,
If you lay down long enough, it will turn.
and if someone has sacral edema, if they stand up, a while, it turns to pedal edema?
Yeah, this just has to do with gravity and what you can do. 100%. Okay, so now the same thing happens over here. So if they have CHF, this blood is going to back up, and it's going to back up into the lungs. Remember, this alveoli represents all the lungs. So the blood is going to get in between the capillaries themselves and the alveoli, and some of it will even seep into the alveoli too. And it's going to do what? What is it doing here? What is it interfering with?
Gas exchange.
Gas exchange. And what is this called again? When we have fluid buildup in the lungs?
Oh,
Pulmonary edema.
Pulmonary edema. So let me give you a scenario. You walk in, this is your patient. Brian is your patient. He's laying, but he's not laying, so right now he's in Fowler, but when you first come up to him, he is completely supine. And he's like, I can't breathe. This is a scenario you're gonna come across, it's gonna be very common. What should you do first and why, based off this information? So there's no trauma, it's medical, you just walked in, got an 87-year-old male laying down, struggling to breathe.
PSI, PPE.
Besides that.
Okay. No, I'm gonna check for his sacral edema.
Before you even check for
You're
second,
gonna sit him up?
sit him up. You're gonna sit him up in the Fowler. Why are you gonna do that?
So
It's
there's
easier
any
on the
fluid
lungs.
buildup, it goes towards the bottom?
So if Brian is laying down, all that blood these are your lungs, all that blood that's backing up is covering your lungs. As soon as you sit him up, now he's happy, he can breathe. These are the lungs, all that blood is gonna pour down and it's gonna cover less surface area, so it's gonna cover less alveoli. So it's gonna allow for more gas exchange. And then you would check for what?
Then I would check for his.
Sacral edema, right? No, I can't reach my
I'm
back.
trying to figure out.
No, I mean,
Okay.
you're gonna check for sacral edema in his back. And that's because you took this little course right now. So you knew that if he was laying down, first thing, quick fix is I would prop him up. And then if his respirations got better, positive, that would tell me, you know what, this patient probably has CHF, and they're probably having blood backed up into their lungs. How am I gonna verify that for sure? By checking for sacral edema. Right? Make sense? Does it make sense now more this time that we went around it?
Yeah.
After I had my in and out? Yeah? Who can tell me what this patient can benefit from? One major thing. We haven't gone over it, so if you don't know it, that's cool. But there's one thing that any patient that has pulmonary edema will benefit from a lot. Besides, unless they were a trauma patient. So, what? No, besides that. No, like right now, you can do 100% on a heart transplant. But something that you have in your rig. So this, no, aspirin, no. It helps drowning patients. It helps patients.
Suction?
No, and it helps these patients mainly. You guys
She
don't.
said it yesterday.
What, like a blood thinner?
No, it's no drug. It's not a drug at all.
Oh, okay.
It has to do more with airway management. So the C, you guys don't know it?